I love watching people get better. Hi, I'm Dr. Josephina Benincasa-Feingold, and this is Valley Health and Hyperbarics. These chambers work in the hospital, and we use them for various things like carbon monoxide poisoning, and we use them for chronic osteomyelitis. We use them for non-healing wounds. There have been centers like mine that we use these chambers we call them off-label application, will treat conditions such as cerebral palsy. So there were several studies that showed that kids that have cerebral palsy improve with hyperbaric oxygen therapy. That is how I started it, and I basically changed my career to continue treating my daughter. We try to have a systematic approach to many conditions. There are, however, many diseases and many conditions that we don't have simple solutions to. Some of them, like chronic Lyme, chronic fatigue syndrome. Generally, the hospitals will not allow patients in who have chronic Lyme or who have cerebral palsy or traumatic brain injury. There's more and more data now that's coming out on near drownings. About 20 years ago, between Dr. Harch and Dr. Neubauer, they showed that the faster you get a near drowning victim into a hyperbaric chamber, the more likely they were to make it out without any neurologic sequela. There's a lot of data that's now coming out of Israel with traumatic brain injury and hyperbaric oxygen. So when people talk about like what conditions we treat, what are the things that I think are very valid and that we can see improvements. There are parents whose children have had severe events that have changed the course of their lives. A lot of patients with traumatic brain injury, for example, motor vehicle accidents, falls, skiing accidents, all kinds of things. And I think the most devastating thing for a parent is that that child remains trapped in the way they are and they can't communicate. So I've wanted to give that opportunity to parents. I've had some children that did a major shift. Ability to walk, ability to talk, ability to study, all of that. The other children that we treat, obviously, when I say that we treat, is we intervene in some way. We don't cure anything. There's nothing like we cure autism, we cure CP, or we cure whatever. We don't cure anything. But we have seen major improvements. One of them is autism. We see this all the time. Around 2004, I remember treating the first few patients on the spectrum, and just because parents were desperate and they said, could you at least try? And we did, and we saw a lot more speech. We saw a lot more eye contact. In those days, you know, the boom in children on the spectrum, we saw the huge rise in numbers. There was ultimately a study that went on, multi-center study that was done with hyperbarics. Dr. Rosenall was one of the leaders in this study that showed that inflammation goes down, and it showed that children that are on the spectrum actually have improvement of eye contact, improvement of speech, calmer, better digestion. So these are all things that are so valid, and it's not like we have good answers in mainstream. And so this is where my passion has led me. So my favorite things to treat are actually traumatic brain injury, cerebral palsy, and autism, because we do see changes, and that gives you a lot of satisfaction. I love watching people get better. I don't assume to be the primary care physician for anyone. I prefer working as a team because we all bring a certain skill set to the table. So while there's, like, for example, pediatricians that do, developmental assessments, I really love working with pediatricians who are open-minded, and they could say, oh, well, we need to do X, Y, and Z. And I will say, well, this could improve, hyperbarics could improve his language. And sometimes we need to do supplementation in some form. So I prefer working as a team with other doctors. The other thing that I think is very valid is actually cosmetic surgery, plastic surgery. So we often will get patients that needed to have a procedure that just didn't heal well. And so in those cases, we put them in the chamber, and healing is definitely accelerated and enhanced. In those cases, I work directly with the surgeon, and I tell them, listen, I think we need to do 10 treatments. I believe this is how we need to handle things. And we take pictures of the site and we show that to the surgeon, or they take pictures when they examine the patient and send them to us. But we definitely work as a team.